Hello friends, just a few more days for Neetpg. Whatever revision schedule you're following, just go through on it. And what I want you to imply in this video is those areas in this vast medicine subject which you should never miss before going for NEET. Okay, let's see that in a short span of time. First, it's always your previous year questions. Obviously, if you do minimum 2 years questions, it's more than enough. And if it's ideal to do at least 3 years previous Neetpg questions. And next comes the most important weightage will be the ABG. Definitely, you will be getting 3 to 4 ABGs you can expect, and that too a simple ABG you will definitely get. Okay. Just if you are able to interpret metabolic acidosis, alkalosis, respiratory acidosis, alkalosis, definitely this question will be there. And also try remembering those compensation formulas for ABGs. Based on this also, you can expect a question. So ABG, you should never miss. First, try focusing ABGs and finish it off. Next, focus on the electrolytes part. Mainly the potassium segment, they have been repeating again and again. So hypo and hyperkalemia, how to manage, what is the correction they are doing in hyperkalemia, what are the drugs they are giving, this you should be remembering. And what are the causes, basic causes of hyper and hypokalemia, and ECG changes of hyper and hypokalemia. This should be in fingertips. Try revising this first. When hyper or hypocalcemia, same thing. Revise those management protocols, how to manage. Next, ECG changes. Next, see, I'll be discussing the topics based on the weightage pattern. Like first is always ABG. Next will comes your cardiovascular system. Cardiovascular and CNS. This holds the majority of marks in medicine. So first comes to cardiovascular system, ECG. Just focus on the basics of ECG. Check like waves of ECG. How are they caused? Why are they caused? These things. Intervals, segments, waves. Then comes on the ECG diagnosis. In diagnosis, majority of the times they are just repeating on two things. Either it will be atrial fibrillation or it will be ventricular tachycardia. So better be thorough on this management protocol, how to diagnose this in an ECG, how to like manage a patient of AF, what is the anticoagulation, how to start with anticoagulation, Chartwas score, and how to like what are the anticoagulants, no local anticoagulants like dabigatran, edoxaban, apixaban, all those things, and warfarin. What are the monitoring, how to monitor during warfarin, these things you should be remembering. Next, that rate control versus rhythm control, drugs in rate control, rhythm control, rate control in like LV dysfunction, what drugs can be used, and beta blockers, contraindicate in asthma. So these things they are continuously asking. And in VT, just remember how to diagnose in ECG. Are you able to diagnose VT or not? Polymorphic VT like Taussig de Pontis, electrolyte abnormalities causing VT, and the treatment, how to treat a case of VT. Next is CPR guidelines, as we saw for ACC, AHA guidelines, like number of compressions, number of rescue breaths per minute, how to monitor a CPR, that entire CO2 and your arterial waveforms. This you should be seeing once before going. Next is the basic murmurs in each valvular heart disease. Next, you should know about the secondary prophylaxis. It's most important. Coming on to secondary prophylaxis, they have each time they have either a secondary prophylaxis of infected endocarditis or secondary prophylaxis of rheumatic heart disease. So this you should be sure of. Okay. And coming on to STEMI, MI in STEMI management protocol, like a patient presents you in PHC or in a community district healthcare hospital with PCA facility, how to manage this protocol you should be remembering. Next, emergency questions. Again, next, obviously emergencies. Definitely emergency questions are always play a great role in NEET. First is shock, the types of shock, how to classify a shock, okay, like a cardiogenic, obstructive, distributive, all those types of shock, how to classify, how to manage each type of shock, you should be knowing. Next is pneumothorax. Pneumothorax and ICD insertion are like again a repetitive question. Next is pulmonary embolism. Pulmonary embolism, they have asked once, they have asked about Wells score. So just know an idea about what is Wells score, how to manage a case of pulmonary embolism, whether it's massive, submassive, or small p, and MI protocol, or we discuss. Next is aortic dissection. Aortic dissection, again, you should just at least know, like in a CT image, CT angiography image, or an MR image, how to really are you able to diagnose aortic dissection or not? Okay, this is again a repeated question. Next is head injuries. just try reading it in surgery, that neurosurgery, that EDH, SDH, SAH, as well as ICH. And diffuse axonal injury, this also a repeated question. Next, coming on to CNS. CNS, they have repeatedly asked, first you should know the stroke protocol, the time of onset of stroke, like since how many hours, like what and all the management options available, this you should be knowing. And when to thrombolyze indications, this you should be remembering. Next is UMN versus LMN. This you should be having a brief idea of how to diagnose UMN lesion or LMN lesion. And mainly coming on to NEET, always they focus mainly on the vitamins portion. In biochemistry, apart from the main thing is the clinical aspects of biochemistry, like clinical disorders of each metabolism, and then focus on the vitamins. Vitamins they regularly ask in Neetpg. Okay, and coming on to neurology, in neurology like B12, where and all B12 affects like cerebral cortex, dementia, and the spinal cord, subacute combined degeneration of those spinal cord, those tracts, corticospinal and dorsal column will be affected. So peripheral neuropathy will be there. So the vitamins and the neurological side effects, this you should be remembering, as well as B6, peripheral neuropathy, and B1, reversible in Parkinsonism, and how to like drugs used in the treatment of Parkinsonism. This you should be knowing. Next is Alzheimer's disease. Alzheimer's disease, just know the basics like what are the protein, how is this amyloid protein formed, and where are the location of neurofibrillary tangles, where is the location of this tau protein, amyloid deposits. This you should be knowing. Next is myopathy. Just know the basic features of Duchenne as well as Becker's myopathy. Next is NMJ disorder, myasthenia gravis. At least know the diagnosis and the features, clinical features they have been repeatedly asking. Okay. Next, coming on to the hepatology. Hepatology segment, they are repetitively asking. I can definitely tell. I'm repeatedly asking this hepatitis B portion. At least you should know the diagnosis. How to diagnose a case of hepatitis B. This antibodies and this antigens. This you should be knowing. And when you should treat a patient of hepatitis B. This also you should be knowing. Next, again coming on to CLD, complications they are again and again they are focusing. Mainly this ascites. Mainly in ascites, you should be knowing this SAG, that how to classify into low SAG ascites, high SAG ascites. This you should be knowing. And you should be knowing the SBP part, spontaneous bacterial peritonitis, what is the criteria for diagnosis and how to treat patient of SBP. This you should be knowing. Then the management protocol for HRS, hepatorenal syndrome, as well as hepatic encephalopathy. Both how to management protocols, what are the drugs used, minimum that you should be knowing. Okay, and HE, know those criteria. Two criteria are there, West Evans and the Sonic. That you should be knowing. Next, coming on to respiratory system, just know first thing you should be knowing is PFT interpretation. Basic, the algorithm which we discussed, PFT interpretation you should be knowing. Next is the management for options for both COPD as well as bronchial asthma. What are the drugs used? And in bronchial asthma, specifically know that steps like GINA protocol, like what are the drugs used and what combination of drugs are used. This should be knowing. As well as for COPD, your gold guidelines, ABC. This you should be knowing. Next, for TB, minimal requirement will be in NEET. You should at least know definitions for MDR COX, XDR TB, pre-XDR TB. This you should be knowing. Then tuberculosis prevention treatment, TBT prevention treatment. When you should give. This you should know. Then ADT side effects you should be reading from pharmacology. Next, ABPA, allergic bronchopulmonary aspergillosis. At least know this criteria, where it is commonly used. This you should be knowing. Next is paraneoplastic syndromes, mainly in the CLM. What and all paraneoplastic syndrome possible in what malignancy? Like squamous cell cancer causes hypercalcemia due to the PTH, recombinant PTH. And all the other paraneoplastic syndrome caused by the small cell cancers. What are the possible paraneoplastic syndrome? This you should be knowing. Next, this is for RS. And for renal, first thing what you should know is this HUSTTP, hemolytic uremic syndrome, as well as thrombotic thrombocytopenic purpura. What is this pented of features and what are the causes, the typical HUS, atypical HUS, and how to diagnose and treat. Next, coming on to AK, minimal requirement will be how to like approach a patient of AK, any patient with raised KFTs, what are you going to do? How to diagnose AK, next what to do in ultrasound, and how to diagnose whether it's pre-renal or renal. This differentiation, what we discussed, this you should be knowing. Next, coming on to dialysis. Main thing is what are the indications of dialysis? And in all NEET papers, you can find indirectly they will be asking this indications somewhere or the other. This it should be in this you should revise this well. And next is the cast and crystals, like what RBC, WBC cast, eosinophilic cast, all those casts, where and all it is seen. This is knowing crystals. Crystals you'll be studying in surgery, like those crystals. What are the possible crystals, and what are those configuration and how to treat decision. Next is in with respect to CKD, at least know the electrolyte imbalances. What are the electrolyte imbalances possible in CKD, and how are you going to manage those complications? And next is dialysis. Dialysis disequilibrium syndrome. This you should have a broad idea what is it and how to manage this issue. Next is main thing is most important with respect to nephro is in medicine aspect they haven't asked much of nephro part, but they have always asked some or the other questions with respect to some questions connecting it with pathology. So try having a go through of pathology images and try integrating your nephritic syndrome along with your medicine. What not the chart which we discussed failed revision, like how to combine nephrotic and nephritic syndromes with the pathology images. Should be knowing, because always it's going to be a clinical question when it comes to nephrotic versus nephritic syndrome. So this you should be revising. Okay. Yes. Next, coming on to least importance, like in rheumat, should know basic things. What they are repeatedly asking is they have left those SLE segment. They are mainly focusing on the arthritis segment, like ankylosing spondylitis, gouty arthritis, how to diagnose. Simple case of gout they'll give. Simple case of ankylosing spondylitis, it's sacroiliitis they give. This you should be having a broad idea. Next is RA. Rheumatoid arthritis, again important, because in rheumatoid arthritis, two things are to be focused. One is the how to the drug regimen followed, how to manage a case of RA, and next is deformities. Deformities are most important. Just have a quick go through of what are the possible deformities, and then go along. Next thing. Next is lupus nephritis. Same thing. It will again come as a component of renal as well as pathologic associated part only. Next is vasculitis. Should be knowing in detail of all the vasculitis, 3 types of vasculitis, and also Kawasaki. Everything should be revising well, because their questions have been asked repeatedly. Next is least segment will be the endocrine segment. But in endocrine, if you see this thyroid section, you will definitely get 2 to 3 questions, definitely. And the possibility is it will be distributed among surgery as well as medicine. So in medicine portion, what you should be focused is, one is myxedema coma, next is thyrotoxic crisis, the 2 emergencies seen in thyroid. Next is the thyroiditis. Thyroiditis is most important, and you should be knowing, able to differentiate the painless, painful thyroiditis, what are the types of thyroiditis, like how to diagnose, where ESR will be elevated, what is having severe pain, how to manage the thyroiditis. This should be having a broad idea. Okay, postpartum everything. Next is coming on to thyroid cancers. This you should be learning in pathology integrated with surgery. This they have been asking regularly. So this you should have a proper idea. Next is coming on to diabetes. At least know the DKS segment as well as HSS segment. So this I just arranged it in a sequence of repeatedly asked and maximally focused segment to least focused segment. Okay. So try revising all these things when you are having a revision for medicine. And for the last 2 to 3 days, what I will be suggesting you is better go for those volatile subjects like biochemistry, forensic medicine, and OBG, obstetrics and gynecology. This segments, if you revise it again and again, this will have a great yield when it comes to Neetpg. Okay. That's it. So all the very best for all of the students going for Neetpg. Thank you.